So today we will demonstrate how the cover tests are performed. Cover tests have basically three different types. One is the cover test, second is the uncover test, third is the alternate cover test. In cover test, we see the manifested squint, that is which is already visible. In uncover test, we see the latent squint, which is the hidden squint. In alternate cover test, we measure the both. Now, after consent, for example, see straight ahead. For example, this eye is divergent outwards. For example, so what is your good name? Kashif. Kashif, please, will you see the finger? Yes. So, you have to look here, okay? Now, you keep looking here. Now, I have asked him to see lateral side. So, you think this eye is straight, for example. The right eye is straight and left eye is divergent. So it is divergent squint and you will perform the Hirschberg test. If this is the condition, then you will cover cover test first of all, which we will do. We will cover the normal eye. Okay? And we will see the movement of, these are very important things, remember. We will cover the normal eye and we will see the movement of the deviated eye. Okay? Normally it happens. Now when I will cover your eye, you will start at my finger. You will see at my finger. Okay? Now I am going to cover it. This happens. This I am demonstrating by eliciting it schematically. Actually, what happens when the patient is actually has got the deviated eye? When you cover the normal eye, the uncovered eye takes up the fixation and he starts looking from that eye. If the vision is good in that eye, if the vision is very poor, then he may not, the eye may not come inside. Normally, it does. This is the basics of cover test. Now uncover test. In uncover test, we cover the whichever eye which cover, because we cannot usually see which eye is deviated because it is latent squint. We cover any eye and when we uncover that eye, we see the movement of the same eye, not the opposite eye. So now see straight ahead, we perform the cover test and uncover test at 6 meters and at near meter 33 centimeter. For example, I am performing it at 33 centimeter. See at my pen, for example, this pencil. Now I am covering his right eye. See, you have to give a very clear cut instruction. So because you have to make sure that patient uses his accommodation. So give me some pen. So I will ask him categorically, see at the tip of the pencil. Now he will use his accommodation and I will cover his eye, one eye, and I will see the same eye. And what I see, this slight movement from outward to inward. So it means it was outwards and outward is
divergent.
So it is exophoria. Tropia is manifested squint and phorias are latent. So it is slight exophoria. Now this eye I will, this could not appreciate. See at the tip. Same slight movement on the from outer to the inner. So this is alternate exotropia. Or and alternate exotropia, there is no need to say it alternate exotropia. Exotropia or esotropia. Uh, uh, Fourier, sorry. Exophoria or esophoria. They are present in almost 98 to 99% of people, and they are normal. Mostly exophoria is more common. Now, what is alternate cover test? Alternate cover test is that we place the occluder in front of the one eye, and then for 2 seconds before the first blink we place to the other eye, and at the end of the test we see the status of the both eyes. And if the eye is normal, both eyes will become straight at the end. If at the end of the test, and if there is phoria, that may not be detected. Uh, Look at the tip of this. I am now covering this, this, this slight movement of lateral phoria, and now this and this. Now when I move from here to here, before the patient blinks, if the eye remains outward or inward, you will say it has got the deviation, convergent or divergent. Now I will add before the first blink, if it is deviated, you will note that it is deviation. And at the end of the test, if any of the eyes is deviated, that is the squint, it can be esotropia or exotropia. Or if the both eyes are straight, then you can say that it is normal. So these are the three basic types of cover tests: cover test, uncover test, and alternate cover test. Thank you very much.